Hello, everyone. Dr. Stillman here, joined by Kathleen Horstmeyer. We are here in the next episode of our ongoing light therapy series, and we are talking today about light therapy for cancer. And this is one of the top reasons why I decided to do a light therapy course. So I'm excited to get into it today. Kathleen, anything you want to share before we jump into the material, which, by the way, I've decided to create an outline for you guys so you can see it on the screen right now.
Yes, I would just like to say, I'm, of course, one of your biggest fans and followers, and I love everything that you give us in the community. But I will say, and I know I'm partial to this, I think this is the biggest gift that you can give to your followers. This course on light is the biggest life-changing offering that you have, and you're doing it for free. So
yeah, if you haven't, sorry,
that was it. I just really, people pay attention. This one is big. It might be free to you, but it's
on that note, we're probably going to cut off free enrollments at some point, and then it'll be $9.95, except when we do something like a special or sale. We're going to have members only discounts as well. So if you haven't heard or realized, we have a light therapy course at stillmanwellness.com. If you sign up for the newsletter, you will get links to webinars like this, and you'll be able to go to the light therapy course and get it for free. Right now, we'll have weekly Q&As coming up where we're going to talk to people about not only how this works theoretically, but also what we actually see in clinical practice. These webinars are really more of a theoretical basis and then a background in the literature. They're going to run about 30 minutes-ish. We're going to try and keep it under that to keep it brief and high level. We're not going to mention products because products change, companies come and go. We want to really provide value that's durable forever. And that's why we're, by the way, not going to mention product names. So jump into the light therapy course. And without further ado, let's talk about light therapy and cancer. So what we're going to talk about today, light, mitochondria, and cancer, light and skin cancer, light and head and neck cancer and brain cancer, light and solid organ tumors, light lymphoma and blood cancer, and then light and cancer prevention. So, all right, now that we've covered what we're going to cover, let's talk about the origins of light and cancer. If you have not read Tom Cowan's book on cancer, it's called Cancer and the New Biology of Water. It is an amazing, amazing book on cancer. Have you read it, Kathleen?
Yes.
It is so good. And what's great about it is that he really unpacks in great detail, but also very accessible terms. I mean, Tom has spent decades as a clinician, so he learned how to communicate with people really well, which often we find problematic in our world. And he explains how light actually affects the cell and the mitochondria and energy generation. And in this way, it may be our most exciting therapeutic, not only for active cancer, but also for getting people through chemotherapy and helping people heal from cancer. And his name is Tom Cowan. Jill, good to see you here. So it's Thomas Cowan, Cowan, and he's an MD. M as in Mary, D as in David. So I'm going to give you the 50,000-foot view of what he explains in that book in much more detail, which is essentially that cancer is a mitochondrial disease, which means that when the mitochondria develop certain mutations and defects in their metabolism, cancers will invariably arise. And this is something that's not well appreciated in the conventional medical world, even though this is not just the world according to Dr. Stillman and his hippy-dippy wellness friends. This is real, legitimate science. Thomas Seyfried has been publishing on this for decades. Before him, people like Otto Warburg and all kinds of people have commented on this. It's not a nuclear genomic disease as people have been told it is. That's part of why the war on cancer has been such a dismal failure in terms of outcomes. We've spent enormous amounts of money for, frankly, very little headway. And it's partly because people are missing the light side of this equation. And in a nutshell, what happens when light hits water is that it programs that water in a certain way. And as you program water, you will actually alter energy generation in the cell. And you can actually use light in this way to tune mitochondrial metabolism and improve it, taking the mitochondria away from the cancer state. Now, why do I say that with great confidence? Because one of the things you'll notice in the literature is that light therapy, and this is one of the most common questions that Kathleen and I get from people who are interested in light therapy, what they hear is that light can stimulate stem cells. And that's true. Cancers are stem cells that have gone awry. However, interestingly, whenever we've studied light therapy in cancer, we have not been able to find that light therapy worsens cancers, which then begs the question, if light stimulates stem cells, why doesn't it make cancer worse? And the answer is that the mechanism by which it stimulates stem cells is at the mitochondrial level, and it makes the mitochondria healthier. And by doing that, it improves the health of the cell overall. And that's why you will find all over the literature people using light therapy, specifically red and infrared light, in order to actually treat cancer and also help patients who are struggling with the side effects of cancer treatments. One of the foremost areas that this is being done in is head and neck cancer, where, radiation, which is a big part of the standard of care, they'll use red and infrared light therapy for people who are struggling with what's called mucositis, which is basically radiation burns to the mouth, the throat, esophagus. They'll help them with red and infrared light therapy and help them to heal from those ulcerations. So, Kathleen, did I miss any big points about?
No. What comes to my mind, because I always go back to the simplicity, and you're always very deep, which is why I love you so much and what you bring forth is. But what I think about is how interesting that the sunlight is 50% infrared light. How interesting.
Yes.
How interesting that we have all these cancers that have exploded since when? Since we were brought indoors away from the sun. Then the sun's been demonized. That's what immediately comes to mind when you're talking about the infrared light affecting our mitochondria.
Yes, and that's a really important point for modern people to realize, is that as we've moved indoors into an artificially lit environment, the rate of every cancer, practically speaking, has exploded. This is not small increases. You look at something like even melanoma, which we'll talk about in a minute. Melanoma has doubled in incidence and significantly increased in severity since the 1950s, which is paradoxical because they say, well, melanoma is caused by the sun. Well, if the sun causes skin cancer, then why, as we moved indoors away from the sun, have skin cancer rates gone up? And why also do we not see increased rates of melanoma in people who work outside? Gardeners, electrical line workers, many other occupations work outside day in, day out, often in very, very brightly lit environments, places like Florida. We've never actually documented an increase in melanoma in these workers. And so when people tell me that the sun causes skin cancer, I say, well, if the sun causes skin cancer, then spoons make people fat, because this is not a fair statement. No. The sun cannot be blamed for all of the rise of skin cancer at all. And in fact, when we look at the literature, we know that more sunlight, the more sun you get, the lower your risk of death, which is part of why, when people say, well, you should avoid the sun because you should worry about skin cancer and skin aging, well, that might be true. But if you do that, you're actually technically increasing your risk of death. So do you care more about your skin health and how youthful you appear, or do you care more about your risk of death? And that includes, the number 2 killer of Americans today is cancers. It's competing with heart disease. One may fall to the other sometime in the next few years. Those numbers of the cancer rates are really exploding, and the aggressiveness and the severity, I think, as well, are increasing. And those numbers, by the way, I don't think people realize to what degree we have an epidemic of cancer today. I know doctors who are decades ahead of me in practice, who, when they were learning medicine in medical school, if there was a lung cancer case in the hospital, all the medical students would be called to go see the patient because it was so rare. Cancer was very rare. And people will say, well, people are living longer, and that's why we're having more cancers. And there's a truth to that. But effectively, the gains in longevity do not completely explain the rise in cancer, particularly in some cancers, for example, that affect young people. And this indoor lifestyle definitely fits that. And that's part of why, I put on the outline light therapy for the prevention of cancer. No one has studied light therapy for the prevention of cancer that I know of. But based upon all the mechanisms we're aware of, I have every reason to believe that if you can't go out and get an abundance of natural light, then every day, day in and day out, as arguably one should for optimal health, you can at least supplement with light from red and infrared light therapy panels or saunas. That's part of why I'm convinced sauna has such a powerful effect on reducing mortality. You know, the more sauna people get, generally speaking, the longer they live. And I haven't looked at this, but I'd actually be really curious now that I think about it to survey the literature on sauna and cancer, because it wouldn't surprise me if people who sauna more get less cancer and they get less severe cancer. But there's a lot of dynamics there, so I don't want to make claims that I can't support from the literature.
And what about all the indigenous tribes all these years? Well, including, us, a few hundred years ago, we were
Right.
all outside. We weren't shriveling up like prunes, and we weren't dying of skin cancer or every other cancer imaginable.
Right.
So, nobody's studying any of that, because why? It's going to uncover what's really going on, which
Right.
is our indoor lifestyle. It's not the sun, it's our indoor lifestyle and our lack of circadian rhythm. We have, we're not honoring the darkness at night, and we're not going out and getting light on our skin and in our eyes during the day.
You know, that's a great point that I really didn't make either in the outline or in my preamble, but artificial light at night is a major, major problem that many people are not aware of. And there's a huge link between artificial light at night and cancer. We know very well from the literature that artificial light at night is linked to an increased risk of many different types of cancers. We found this out in shift work research really in the late 1900s, but it continues to be validated. And the reason that's so important is that we can talk about light therapy all that we want, but the reality is that if you don't fix your artificial light at night problem and optimize your circadian rhythms, you're not getting that restful, restorative sleep. This is why sleep deprivation is also linked to the kind of problems that then can give rise to cancer, and why also the better your sleep, generally speaking, the longer you live and the healthier you are.
And I know you've heard of Dr. Martin Moore-Eid. He also has I think his most recent book is The Light Doctor. But he was a researcher. He's a physician, a researcher at Harvard, and they found by 1980, his research group in Harvard had discovered and proven that artificial light at night was a causative factor of all hormonal cancers, breast,
Really?
ovarian, testicular. This was 1980. Dr. Stillman, this is almost 45 years ago. And who has heard of this? No one. Gee, guess why? And he did actually a brilliant podcast on Quantum Biology Collective with Meredith Oak, and brought all this forth. And he said not only his group from Harvard, but many other research groups confirmed this. In 1980, he said, we all knew this. Has anybody ever heard that? All these.
It's funny that you mentioned this, because I actually am not familiar with his work.
Oh, super, super interesting guy. And he has he's a big light guy. He's a wonderful, wonderful human being that has brought a lot of information about light out.
What was his episode with Meredith?
I don't know what episode it is, but it was this year that it came out.
Okay.
Martin Moore-Eid. And his latest book was The Light Doctor. Got it.
People can look that up.
Yeah, great, very interesting thing. And, Meredith, of course, as myself, who everybody's pretty much had somebody that's passed from cancer or, is going through it. And especially a lot of us have had friends with breast cancer.
Mm-hmm.
And when you think of all that they do everything, trying, everything, their diet, everything is perfect.
I know.
And had they known that,
well, we might not have as many of them, right? not only we might also have better survival rate.
Maybe they could have had a better outcome too. It's maddening, but it's a big deal. And what you're doing today, being able to get this out there, that artificial light at night is deadly. It's deadly.
It is. I agree. And it's a known. I mean, it's even listed as a carcinogen. I mean, I can't remember who listed as that. It might have been. I can't remember who did that, but that was in 2007. So let's chat about light and different cancers. So one thing that's interesting about the skin cancer literature, because I put that first on the list because of the obvious link, is that, it stands to reason that if skin cancer is caused by sunlight and is made worse by the types of light therapy that we're going to talk about more in the course in the Q&As, which usually are red and infrared light. If that's the case, then it would stand to reason that people who get more sunlight have a worse outcome from skin cancer. And this is something that really, again, is the fly in the ointment of the cancer literature on light, which is that when we've done studies on this, we've found that the people who actually have skin cancers, specifically melanoma, the people who live the longest actually get the most light and the most sunlight. And that was very contrary to what the people who did this study, it was, I don't have an exact citation, but it was 2005, Marianne Berwick. She led a research group who studied this and found, in fact, that the people who lived the longest with melanoma were paradoxically the people who had gotten the most sun and used the least sunscreen. And they comment on in their paper that this is a very unexpected finding, very paradoxical. And of course, they say more studies are needed, right? I would extrapolate or infer from this that when we study practically everything about how light affects the skin, it improves mitochondrial function, rest, regeneration, health overall, mitochondrial function, as I said, it stands to reason then that red infrared light therapy would at least not be harmful in skin cancer and might also be helpful and effective, although I haven't seen anyone use it that way. And I'm not, by the way, this is not medical advice. This is just information. This is a conversation, not a medical consultation. And it's very important for people to realize that, I mean, I've had suspicious moles removed myself. So there's no substitute for getting good dermatological care and so on and so forth. But I strongly believe that when we do finally look at this, we're going to see that red infrared light therapy improves skin cancer outcomes and also prevent the aging that we see going along with sun exposure, which is a huge, huge issue for people. So beyond skin cancer, head and neck cancer, I mentioned earlier, they are already a lot of the treatment and a lot of the scientific literature on red and infrared light therapy or photobiomodulation focuses on the use of red and infrared light to treat people who've got complications of radiation from head and neck surgery. And I actually didn't know that until I got into it. And it's actually very effective for people who are undergoing this and can provide them with a lot of pain relief and improved healing, which is why I wish more people knew about it. It's actually pretty widely available. And again, is another piece of evidence that, even if you use red and infrared light therapy, you're not going to make cancers worse by stimulating stem cells. And then the other tumor in the head and neck is obviously brain cancer. One of the most interesting papers I've ever read, Melatonin and the Optics of the Human Body. I can't remember who wrote that, but it was actually featured in one of Meredith's recent quantum biology collective podcasts with Dr. Seheult, Seheult, another good QVC podcast for people to go listen to. But that paper is really interesting because they get into how infrared and red light is funneled from the furthest reaches of the brain deep into the brain. And there are some photobiomodulation devices that have been designed to treat the brain with red and infrared light. They've been specifically designed for things like traumatic brain injury, but I expect that they will then eventually be used for things like brain cancer. And from what I know about people who've had to have, for example, brain surgeries, I expect that they will become part of the standard of care for post-surgical recovery because there's no reason we wouldn't do it. And based on the fact that red and infrared light therapy has never been associated with an increase in severity of cancer for reasons I've already, I think, hopefully addressed adequately, I don't see why we wouldn't use them in all cases of head and neck cancer. And I know certainly if I had that, or if I had a brain cancer, red light therapy and infrared light therapy would be two of the things that I sought very carefully to make sure that I had them on board in my treatment plan.
Oh, absolutely. And I mentioned earlier about Dr. Martin Moreed. He, in his research, he was the guy who discovered the suprachiasmatic nucleus, the SCN, in his research,
Wow,
which,
that's interesting.
as you know, is that that is the time clock for the body through the eye,
Yes.
and which that it has, that's our major time clock. We have little clocks in every cell, and our body is designed to run on a schedule. It has scheduled things that it does. We all know, we've heard about, melatonin at night, it's the darkness hormone. Well, if you don't get darkness at night, that's not going to be released. You're not going to have that cleansing in the brain, and of course the rest of the body, but that's going to affect our brain.
Yes.
And that again goes to that, if we're getting light at night, artificial light at night, it just, I know I sound like a broken record, but it's a really big deal to have that normal circadian rhythm telling our body what's supposed to be happening.
And on that note, it's part of why I'm convinced it's a big part of why we've seen an explosion in not only head and neck cancers, but also in brain cancers.
Yes.
Yeah.
I mean, just think about it. Instead of us being in a dark, in outside in a campfire, or in a cabin with maybe a little fire going and then darkness, we're now watching television, looking at our computer screens and our phones, until then we turn them off at who knows what time, and we expect we're going to go to sleep.
I know.
We've just been telling our brain it's noon.
And another important component of that people don't realize is that red and infrared light, when they hit the skin, not to mention the eye, trigger the production of melatonin. And what we've seen in some studies is that the more red and infrared light someone is getting, the more their melatonin levels will rise at night. And this is for a variety of reasons. I won't get into all of them, but it stands to reason then that if you get more red and infrared light on the skin during the day, you might see on a population level, a improvement or a reduction in the rate of these various cancers, as we've talked about.
I think that's so exciting. I mean, think about it. If you have melatonin being made in your cells and released, what's that doing? It's helping to cool your engine, which your cells, the engine of your of our body is our cells. We're cooling that engine. So what doesn't happen? It doesn't oxidize. And then what happens? When that happens, we have warped cells. What happens then? They can progress on to cancer.
And that's one reason why, too, if you look into the integrative oncology world, there's a lot of papers out there on the use of melatonin to treat cancer. Yes. And it's one of the things where they've done lots of studies on it. Some of them find efficacy, some of them don't. But a lot of them are missing the fact that the melatonin production in the body is stimulated by these frequencies of light and is maintained by the circadian rhythms. And so they're sort of missing the forest through the trees and looking for just another answer in pills, which is just a function of the fact that modern biochemical scientists and biomedical scientists and physicians haven't been adequately trained on the use of light, which hopefully we're helping with through this course that you guys can sign up for through a link in the comments. And on that note, let's talk about light and solid organ tumors, lymphomas, blood cancers. So this is another area where I haven't seen a lot of literature published. But people ask me, my so-and-so's got cancer of this or that or the other organ. To go back and reiterate what we've already said, I think many times, we haven't seen the incidence of these different cancers decline with modern living. If anything, they've just exploded in prevalence. And if they haven't exploded, they've at least risen significantly as we've moved indoors away from red and infrared light from the sun. So we're getting far less red and infrared light. We have worse circadian rhythms than ever due to artificial light during the day. We know melatonin is implicated in the pathogenesis of, and therefore is implicated arguably in the treatment of cancers, which is why it's getting so much buzz in the integrative world. What does this say, or what can we extrapolate then to various other forms of cancer? And I think in my book, in my clinical opinion, what I believe we're going to find when all is said and done is that red and infrared light are useful for treating and improving outcomes in people who've got all of these different forms of cancer. And again, I say that with the caveat that I haven't seen an abundance of literature on that yet. But one thing I want people to know about this as we go through the course is that people, thank you, Linda, by the way. She's noticing that I did get married recently. So red and infrared light. I'm convinced that what we're going to see is that it becomes a useful adjunct to people in the treatment of cancers, and it's going to improve survival and outcomes. But you have to realize that where we would like to be in studying this is, I think, years and decades behind where we should be. Where we are now is decades behind where we'd like to be. And that's largely because, and this is why I decided to make this course free, there's no one out there explaining this because there's not a great profit model behind the majority of light therapy, which is a problem we'll talk about more in our Q&As when people invariably ask us about different products. No one is out there making money off of sunlight yet. And no one is out there making money telling people to go to bed earlier. Quite to the contrary, our modern economy runs on people being plugged into technology 24/7 and not being outside in nature, in touch with natural light, sunlight, which we know protects us from death and improves our health and improves the function of our mitochondria. And until society gets real about its need for these optimal types of light, they are going to continue to really struggle with their health.
Not to mention that, sunlight's been demonized. I mean, I have clients that, when I bring this to them, they're afraid. They are afraid of sunlight. Children.
Well, yeah. Let's put that in perspective, though, because I think it's really worthwhile to put it in perspective. So when I last looked at the numbers, all told, about 12,000 people die a year of skin cancer. 7,000 or 8,000 from melanoma, that's being generous, and then 4,000 or 5,000 from basal cell and squamous cell. Now, many more are sadly disfigured by these diseases because you got to have chunks of skin cut out when you go for surgery for one of these. And again, I don't want to diminish or demean the value of having things cut out before they metastasize and get big, right? But here's the thing, right? As we've seen these cancers go up in prevalence, there's still only about 12,000 people, as I said, dying of skin cancer every year. Well, how many people in the year die in the United States? It fluctuates between something like 2.8 and 3 point something million. And the top two killers are heart disease and cancer. What are the top two contributors to heart disease and cancer as far as your risk factors? Eating processed food, things like artificial light at night, things like stress, things like lack of sunlight. And so what you'll see, if you look in the literature, is that the more of these healthy things people get, the lower their rates or risks of dying. And in the grand scheme of things, are you more worried about a disease like heart disease that's killing hundreds of thousands, several hundred thousand people per year, or cancer, several hundred thousand people per year at least, right? Or something that's killing 12,000 people per year and can be easily detected. And that's another thing, people don't realize, a skin cancer might be scary, and I'm not trying to diminish that. I've got family members who've had skin cancer that was potentially lethal. But the reality is they were able to see it and they were able to catch it early and have it cut out completely. And you look at solid organ tumors, which lack of sunlight puts us at risk for in a significant way, I would argue. You look at those tumors, they may not be caught until they're much too large to be operated on. And even then, detecting something like colon cancer requires a colonoscopy. It's a procedure. You need a physician to run the procedure. You need someone to interpret it. It could take weeks to get in. It's a very different ballgame in terms of lethality. And then the medical complications, it's way different to have part of your colon removed than it is to, say, have a piece of your skin taken out.
Indeed. And all of those, not making light of any of them, but I just wonder how much we would be seeing had people known, had the sun not been demonized, and had people been taught good sun practices and taught about artificial light at night
Yeah.
and the use of infrared, especially light, um, if you're having an indoor life, how that would affect those outcomes, and maybe would we even be seeing all those cancers? I I don't I don't think so. I mean, bad food is not good, but I think sunlight can cover a multitude of sins, so to speak.
We see that clinically. A lot of people who jump outside and get more sunlight notice a lot of their medical issues improving, clearing up. And that's really well supported in the literature. I don't think I'm going out on a limb there by saying that. And last, I want to talk for a moment about cancer prevention. I really do believe, as I said before, as I opened this, that red and infrared light, phototherapy, light therapy, in the literature, we've never seen them worsen cancer outcomes. And that's been a big, big question, because if they do, then we really need to be careful with using it in cancer patients. But we haven't seen that. Quite to the contrary, we found it to be very, very helpful and has not created complications or worsenings in patient outcomes from their cancer. So do I think that light therapy could play a role in preventing cancer? Of course I do. The literature is strongly there to support that. And that's part of why we're such big fans of red and infrared light therapy, other types of phototherapy that we'll get into more specifics of in the course. Again, you can find out more about that at stillmanwellness.com. Sign up for the email newsletter, and you can get into the course through the link in the comments. Kathleen, any closing thoughts?
Thank you for doing this, Dr. Stillman.
Thanks, everyone, for joining us. Good to see you all. Take care. Have a great day, and don't forget to get outside.
Bye.